Hi, everybody. Melinda Danizio here with my genetic and fetal assessment on biophysical profile, known as BPP, and modified biophysical profile, known as modified BPP. I want to apologize for my voice. Allergies are getting the best of me, and I'm hoping that it clears up soon. But onward we go. So what is a biophysical profile? Well, this is an ultrasound assessment of the 5 fetal biophysical activities that are sensitive to hypoxia. A little history on the test that I came across. It was introduced by Frank Manning and Larry Platt back in the 1980s. They incorporated the 5 biophysical activities that are sensitive to hypoxia into a 30-minute fetal biophysical profile test. There have been minor modifications over the years, and it became the fetal well-being assessment of the United States. And it has been that for about 20 years, give or take now. Current recommendations for the testing, the Academy of Gynecology is recommended beginning at 41 weeks gestation and continuing weekly to 42 weeks gestation. It also can be recommended to have it done if there's changes in blood flow in the maternal and fetal circulations. Another way also is, if mom comes across to noticing decreased movement of the baby. It specifically touches on the 5 fetal biophysical activities that are sensitive to hypoxia. So they're looking for fetal movement, fetal breathing, fetal tone, and the amniotic fluid volume. Number 5 is the stress test, or should I say non-stress test. That's when it goes from the biophysical profile, or the BPP, to the modified biophysical profile, or the modified BPP. Indications for testing. Again, I touched very briefly on what the indications were from the academy, the academic gynecology indications for having it done. Here is a list of other reasons that this testing would be decided to be further done. So you're looking at advanced maternal age, 35 or over, if mom is having twins or multiples, mom is in post-term pregnancy, which is 2 weeks or more past the due date. There is an indication that there is low amniotic fluid. There is maternal obesity or any other maternal conditions, such as diabetes, heart disease, or hypertension. The little chart on the other side kind of touches bases on the some other reasons that they would be done, which we discussed was the lack of fetal movement that mom may feel or not feel over the last several weeks or so. Non-reactive stress test was, not sufficient enough. So we need to look a little further with ultrasound. This is a high-risk pregnancy. Again, that would touch base pretty much on like the multiples or twins or, other things like that. Or there's other suspected fetal distress. This testing would be indicated to use. So what is the procedure for this testing? It's an ultrasound. Many of us may have had an ultrasound in the past. You're either positioned lying down or you're slightly inclined. They use a transducer or a probe. Transducer would go over the stomach or the abdomen would be scanned, creating the wave sounds, which will produce and convert into images on the screen. So what they are looking for are 2 or more accelerations in the heart rate of the baby. Fewer than 2 may indicate that the fetus is sleeping. So then stimulation will kind of be utilized at that moment. They use buzzers to kind of vibrate and buzz the stomach to kind of make the baby move. If the ultrasound portion or the BPP portion of the test has any indication, and we'll go further into what those indications and the testing results are in the next slide or so, then it would move on to the physician suggesting a non-stress test. And that consists of electronic fetal monitoring, which measures the fetal heart rate, and the sensor that would measure and record the fetal heart rate. This test can take from 20 minutes to 40 minutes. It really all depends on the movement and the activity of the little person inside. It does have some advantages and disadvantages, as do most testing. However, the advantage here for these testing, the BPP and the modified BPP, is little risk to the fetus, which is great. The disadvantages of this testing is if it's done prior to 32 weeks gestation, it's not really reliable. So we try to not have that performed until after 32 weeks. Results may be affected by corticosteroids that mom may have been on or is on. And if there's any indication of the test being justifiably interrupted by those things, then it may have to be repeated. And chances are that, sometimes that can happen. The only good thing, again, is that there's little risk to the fetus. Another disadvantage is fetus breathing may falsely increase and movement may decrease for several days after those corticosteroids are taken by mom, so that could indicate possibly for a repeat testing. Contraindications is, as it says here on the signs, if there is any sign of premature birth, any sign of placenta previa, vasa previa, cervical incompetence, multiple gestations, or previous cesarean section, those usually will be indications or contraindications, should I say, that the physicians may postpone or not even proceed with these testings, and it may be just a direct induce of birth. If there's any signs of the following performing would cause increased stress levels on the mother. So then alternative interventions would need to be taken into consideration in regards to this pregnancy. Interpretation. So now we're looking at, the components that come together as they're looking for things in the BPP testing. So the first one is fetal gross body movement. There needs to be 3 or more separate movements from the fetus's body or limbs in the 30-minute testing. We're looking for the fetal muscle tone as indicated. So there needs to be 1 or more episodes of active extension or flexion of a limb, whether it's an arm or a leg, and opening and closing of the hand within the 30 minutes of the testing. Again, we're touching base on the fetal breathing movements. So there needs to be a minimum of 1 episode of continuous breathing lasting at least 30 seconds during a 30-minute test. And the amniotic fluid volume, minimum of 1 pocket of amniotic fluid that measures 1 centimeter across and 2 centimeters vertically. So that's kind of where we're looking at for the components of the test and how the scoring is going to be represented. The results obviously need to be tallied, and this can all be done in the same day. So sometimes they'll have mom or parents, if they're there together, kind of wait in the waiting room and have the physician look over the BPP testing. The biophysical profile are added for a score of 0 to 10, a score between 8 and 10, which is the purple color indicated in the bar graphs here, are considered normal. A lower score, which I indicated with the green, would suggest a possible issue if, and that would call for the non-stress test to be initiated. So that would be where you kind of fall into that green area there. That would bump you up to the modified BPP. A score of 4 or less, which is indicated by the gray color in the bar chart here, would call for pregnancy monitoring or possible inducement of labor, all depending on how low those numbers get. But don't panic. Of course, mom's going to be a little on edge in anyways, because it would be due to lack of fetal movement that most likely brings her here, unless there's other indications that were listed in the previous slides. If the results state an abnormal test, this does not automatically mean that there is a problem. Factors can come into play and affect the scores. This is why the modified BPP will be done in addition. So they'll add the non-stress test. And when the non-stress test is added, there needs to be at least 2 episodes of heart rate acceleration in 20 minutes. So the fetus will move, which would increase the heart rate. And that would happen when mom is pushed through the non-stress test to accelerate her own heart rate, which then would accelerate the baby's heart rate. So that, in a nutshell, is the biophysical testing. Biophysical profile, again, I'm so sorry for my voice, biophysical profile testing and modified biophysical profile testing. Here are my references that I indicated on the slides that I used. They're all here in one slide. Again, you can look over it. It is justified to have this test done if mom finds lack of movement in the baby after 32 weeks. There are indications by the Academic Council of Gynecology that would put this testing into place. There are comorbidities or other maternal illnesses or ailments that would also place this testing of biophysical profile on board for mom and baby to be evaluated to make sure that everything is okay. If there's any questions, please feel free to pop them into the profile where I post. I'm happy to answer anything for you guys. Thank you for putting up with my voice. I hope that these slides were easy to read and follow. And thank you again for taking a look.